Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we face problems in the healthcare system and then take actions to try and make a better system for all of us. Today we have a number of topics, including a new report on women's health in the U.S. Before we do, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. That is the text for today's video. You can go to that link and subscribe for free, and all of the actions and background material and studies and links to scientific journals, it's all in there. Okay, let's get started. Before we get to women's health, I want to talk about ALS, a new brain-computer interface. I used to be a software guy, so I love this. BCI. Brain-computer interface was developed at the University of California, Davis Health, and it is so cool. It translates brain signals into speech. So cool. 97% accurate. It is just incredible. The researchers implanted the sensors in the brain of a man with severely impaired speech because he had ALS. I'll try and do this. Amyotrophic lateral sclerosis, sometimes called Lou Gehrig's disease. He was just unable to communicate beforehand. Afterwards, get this, within minutes, he was able to have speech come out to his caregivers and friends and family around him. It is so cool. Anyway, a study about this was just published in the New England Journal of Medicine. There should be a link to it in the newsletter. ALS, Lou Gehrig's disease, affects the nerve cells that control movement throughout the body. The disease leads to a gradual loss of the ability to stand or walk or use your hands. It can also cause a person to lose control of the muscles that are used for speech, and it leads to virtually incomprehensible sounds. It's not speech. The new technology is being developed to restore communication for people who cannot speak because of paralysis or neurological conditions like ALS. It can interpret brain signals when the user tries to speak, and then it converts them into a spoken sound at a computer. So cool. The UC Davis press release is linked in the newsletter. Go read it. It's just way cool. Let's talk about pancreatic cancer. There are some important updates on this. This is important to me because this is what killed my mom. Scientists at the University of California, San Francisco discovered a way to get rid of pancreatic cancer in mice by putting them on a high ketogenic diet and giving them cancer therapy. The cancer therapy blocks the fat metabolism, which is the cancer's only source of fuel, for as long as the mice remain on the ketogenic diet, and the tumors stop growing. The team made the discovery, which appears in the August 14th edition of Nature, and of course there's a link in the newsletter, while they were trying to figure out how the body manages to subsist on fat just while fasting. So they weren't even looking in this direction. They first uncovered how a protein known as eukaryotic translation initiation factor, ELF4E, I believe that's correct, changes the body's metabolism to switch to fat consumption during fasting. The same switch also occurs, thanks to EL4FE, when an animal is on a ketogenic diet. Very cool. They found out that a new cancer drug that's called EFT508, currently in clinical trials, blocks ELF4E and the ketogenic pathway, preventing the body from metabolizing fat. When the scientists combined the drug with the ketogenic diet in an animal model of pancreatic cancer, the cancer cells starved. This is great. This is firm evidence of one way in which diet might be used alongside pre-existing cancer therapies to precisely eliminate a cancer. Of course, the link to the UC San Francisco news release is in the newsletter. Watch this space. So cool. Women's health in the U.S. If I'm covering a topic like this, you know the answer is there must be big room to improve. A new report was released this week by the Commonwealth Fund on the state of U.S. women's health. Recently released data, federal U.S. data, once again shows the United States with by far the highest rate of maternal deaths of any high-income nation, despite a decline since the COVID-19 pandemic. Racial disparities are also extreme. Black women in the U.S. are 3 times as likely to die from pregnancy-related complications than white women. Maternal deaths and complications are just one indicator of the way the nation's healthcare systems are failing women. Now, the U.S. spends more on healthcare than any other country. Surveys go up and down the board, they always find that. But Americans avoid seeking care because the costs are so high, the personal costs, even as the U.S. continues to lead in the prevalence of chronic diseases. That's not good. At the same time, limited access to primary care and inadequacies in coordination of healthcare services very likely play a role in poor outcomes and performance when it comes to the prevention, diagnosis, and management of disease. Let's talk about specifics. Mortality. As of 2022, women in the U.S. had the lowest life expectancy of our peer nations, 80 years, compared to women in other high-income countries. It's 87 years in Japan, 86 years in France. As of 2021, women in the U.S. had the highest rate of avoidable deaths. This is a sad one because it means that either there's a public health issue that's not reaching women, or they're not getting to the doctor in time. This is a really high number. It's 270 out of 100,000 are preventable deaths for women. All the countries in the Commonwealth Fund analysis, except the U.S., guarantee government-provided health care coverage for all their residents. In addition to this public coverage, women in other countries also have the option to purchase additional coverage, private coverage. I'll give you an example. In France, nearly every woman has private coverage on top of the public plan. In the U.S., 14% of women, this was a big shocker to me, aged 19 to 64 in 2023 had no health insurance, none. And 25% of Hispanic women have no health insurance. Although substantial progress has been made with the enactment of the Affordable Care Act in 2010, many women under age 65 remain ineligible for public coverage or cannot access affordable private coverage. Affordability of care. Women in the U.S. have among the highest rates, and in some cases, the highest rate of skipping or delaying needed care because of the cost of medical bills. Get this, on average, half of all women in the U.S. have chosen at some point to not go to the doctor or get medical care because of their copays or deductibles, or they don't have insurance. That stinks. This is just disgraceful. Everyone deserves to be able to go to the doctor when they need to and not go broke. Everyone deserves to have preventive healthcare screenings and have healthcare and make sure that problems are caught early and treated. It gives them the best chance of success. Our healthcare system is failing. Just look at how many women die needlessly. 270 out of 100,000 yearly that don't have to die. We need everyone to have affordable health insurance. By the way, 900 or so health insurance companies exist in the U.S. and they're not doing it. And one of the big reasons is they have, how do I say this? They have an overhead rate, a cost of doing business of 20+%. A universal single-payer national health insurance trust will save our nation $400 billion every year. I have a link to it, the Congressional Budget Office report. It was done in 2020. It's in the newsletter. Read it. It is just time to act. So let's take an action because this is super important. Let's put this under the noses of the people who can actually do something about it. Members of Congress and senators. Let them know that 270 out of 100,000 women die needlessly because they lack sufficient health care, and that universal health care like H.R. 3421 will fix it. I put a link in the YouTube description box if you want to call or email them, or use my favorite, ResistBot. On your cell phone, send a text message to 50409, and the message is sign, SIGN, space, PYBGEW. That's sign, space, PYGBEW. Oh, I'm sorry, I did that backwards. Sign, PYBGEW. PYBGEW. Got it right. Here's what you're going to send them. I'm your constituent, and I want you and your legislative staff to know about the Commonwealth Fund report that was just released that compares the health of women in the U.S. to women in our peer industrialized nations. I include the link in the email. Because women have insufficient health care, 14% uninsured up to age 65, they die earlier than in our peer countries, 80 years versus 87 in Japan or 86 in France, and the number of preventable deaths is 270 out of 100,000. I didn't mention it before, but let me tell you, that's 260% more than in France. You have an obligation to look out for your constituents. That's why we sent you there. I want you to actively support a national single-payer health insurance trust like HR 3421 that will insure all of us for far less than we pay now. The Independent Congressional Budget Office puts the savings at over $400 billion every year. Link to the report. That's what I've got for you. Down below you can link to the newsletter. You can subscribe to the newsletter. You can subscribe to these videos. You can like them. You can share them. You can also send comments to me down below or at healthcareadvocacy1@gmail.com. Have a good day.